Okay, hello there. So it's great to welcome everybody to the next NHRP Lightning Talk in the program. We've got two speakers today. I think first of all, Vicki Harris, who's head of public partnerships for NHRP, is going to kick off, and then she's going to pass the baton to Grace Gardner, who's the program lead for public involvement and community engagement for the Health Determinants Research Collaboration. So I look forward to a really two fascinating presentations and then some time for questions right at the end. So with that, Vicki, over to you. Thank you.
Thanks, everybody. Hope you can hear me. You can see the slides all right if someone nods, because I'm in a caravan in Rothbury, which is very nice, but I'm having some IT issues. Anyway, great to see you all here. So yeah, Vicki Harris, Head of Public Partnerships at NHRP. Also Head of Public Partnerships at the Newcastle Hospital Trust Clinical Research Directorate, so dual role. So I'm just here just very quickly to talk about some of the work we're doing in NHRP. Part of our overall NHRP strategy, the strategy has in it building patient and public involvement in health research. One of those work streams for 2026-27 is about how do we support the voluntary and community sector and community organisations, VCSE, with capacity and resources to be more involved in research. So with this work stream in mind, I'm just going to feed back on a collaborative event we did on the 10th of February with Connected Voice, Newcastle and Gateshead HDRC, and Newcastle University and Vaughan. So it was hosted by Connected Voice, as they are the local infrastructure organisation for supporting VCSE in Newcastle and Gateshead. It was really important. This initial event sat with them. And the purpose of the event was to build on the great work already being done and build on the engagement strategies that are being developed by those delivery partners, and then offer some practical information and resources for researchers and the VCSE alike, and to think about how do we access better support and information, how do we share ideas and ask questions related to research collaborations. We had at the event 57 people attending, 27 were from the VCSE sector, and so we were able to have conversations about how we take this work forward to ensure better links and support for the VCSE and research delivery partners. So I think it's important to recognise that in the room, everyone was at a different point of understanding of this agenda. So for some people, this was something they knew a lot about, and for some people, this was less familiar. But that allowed us to have some good discussions. And the format was we had presentations by the 6 delivery partners, followed by roundtable discussions with plenty of networking time. And then we also shared up with a follow-up resource pack with relevant links and contact details for follow-up. So what was the follow-up? What did people talk about? From the discussions and the event evaluations, we had a number of things highlighted, and a lot of this won't be a surprise for you. However, we need to think about what do we do next about this. So the first thing was that the VCSE sector needs more support and resources. None of that will be a surprise at all, but we do need to think about how do we do this better? How are we going to do this better? We also looked at we needed more brokerage and oversight with a more holistic approach being needed to support VCSE sector and research partnerships. So we acknowledge that the current provision and resource for supporting research partnerships in Vaughan is really effective for those who develop it, who engage with it. However, we need to think about how do we take this further? How do we support and work more locally to develop this work and work with Vaughan on their model? We also found that connected organisations such as Connected Voice and Vaughan, they're vital, as we know. However, this should not replace genuine relationship building with individual organisations, communities, and we're all responsible for doing that, and think about how we do that in a more coordinated way. We need to think about training and support for researchers and the VCSE alike. So it's available, but what do we need to do to look at how do we take a learned skill set into actually a doing skill set? You know, you can know something, but it doesn't mean you actually know then what to do about that. So how do we support that? And the research landscape is complicated, so I don't need to tell you that. So collaboration is key, and we need to think about how do we better coordinate and centralise research information, resources and opportunities for training between all the sectors, and think about how do we take that forward effectively and efficiently. And the last thing that we found out from the event is that actually people want more events like this. They want people to be able to come into the room, bring people together and look at how we develop these partnerships better. So we are looking at having further events, and we'll be having discussions with our delivery partners and the NHRP partners and NIHR infrastructure about how do we do this. So if this is something you're interested in and you're able to support these events, please do get in touch with me, because that is on my agenda for the rest of the year. And with that, that is my feedback for the event. I'm now going to pass you over to Grace.
Thank you, Vicki. So I am having a bit of Teams trouble, so I'm going to try and share my slides. And if someone could let me know if you can see them. That should be it on slideshow now. Can everybody?
Yeah, we can see them.
Okay. Are they on full screen?
No, they are now.
They are now.
Yeah.
Okay, brilliant. Thank you. Okay, so yes, my name is Grace Gardner, and I'm the Programme Lead for Public Involvement and Community Engagement in Newcastle's Health Determinants Research Collaboration. So obviously both of these are a bit of a mouthful, so going forward in the presentation I will just say PICE and HDRC. Yeah, and thank you for having me here today to speak about how we're going to help include communities and VCSE in health research. Okay, so what I'll cover today, so a bit about HDRC Newcastle, so for kind of background and context, who we are, why we are here. We'll touch on the VCSE reference group and are developing our new community advisory panel, and then a bit of just how to get in contact to keep the discussion going. So HDRC Newcastle is based in Newcastle City Council, and we're funded by the National Institute of Health Research, NIHR. And when we started, we were one of 10 HDRCs across the country, and we're now one of 30. And other close by HDRCs include Gateshead and South Tees. So you might have done some work with them as well, or be aware of their work too. So HDRCs, they're here to build research culture, capacity and capability within local authority and wider partners, creating conditions kind of for everyone to do and use research well. So we're really keen to transform the Council's overall approach to research and evidence and helping it to become a more evidence-led and data-driven by increasing research activity, including insight from VCSE organisations and members of the communities across Newcastle. So while we kind of primarily support research, we also carry out studies where this builds capacity within a directorate or where there might be lack of evidence. And an example here came from an area of research interest, so an ARI identified by the Children and Families Directorate within the Council on school attendance. And if you're interested in kind of finding out a bit more about that, that report is published on the HDRC Newcastle website. So our focus is on health inequalities and the wider determinants of health, such as housing, education and employment, kind of in comparison to more hospitals or clinical data or individual behaviour. And being based in Newcastle City Council kind of gives us that unique opportunity to have access to working with and supporting residents from across the city, in comparison to if we kind of looked only at populations who are registered or via clinical data and speaking to patients. So everything the council does has an opportunity to impact and improve health and wellbeing of people across Newcastle, and there's recognition of the importance of this through the health and all policies which has been adopted by the council. And as you may know, we're committed to doing more about like health kind of in general, and Newcastle's working with the Institute of Health Equity to become a Marmot city and align with the Marmot principles. And these are a set of policy recommendations which were developed by Professor Sir Michael Marmot to reduce health inequalities by addressing the social determinants of health. And this work kind of brings a wide range of people together, including non-academics and people who don't work directly in public health, all kind of working towards the same goal of eliminating health inequalities, which directly aligns with the work of the HDRC. So who are the HDRC Newcastle? So I thought it'd be useful today to kind of give you an overview of the team and highlight the different areas of work that we focus on. So we're split across 4 key programme areas under our HDRC Service Manager and Public Health Consultant Senior Research Fellow at Newcastle University, which is also our official academic partner. So the 4 key programme areas are data and insight, culture and governance, academic collaboration and further funding, and public involvement, community engagement. So PICE in the far right, which is where I sit, along with my colleague Toyin, who's also on the call today. And we're also undertaking interviews at the minute for a second HDRC project manager to sit with us within the PICE team. As an HDRC, we also have a strategic advisory panel, which includes a wide range of partners as well, including Matt Wilton, who's the Deputy Chief Executive at Newcastle City Council and our HDRC Director, Alice Wiseman, who's the Director of Public Health, and Professor Ashley Adamson from Newcastle University as well. So since the start of our HDRC, we've really recognised the importance and valued the importance of including those from outside the council to help shape our work and set our priorities, and particularly from VCSE organisations. One of the first pieces of work that we did was a Barriers to Research Inclusion Toolkit, looking at communities which may be less represented in research, which we use as a basis for kind of selecting organisations to be part of our VCSE reference group. The organisations in our group are also like active in research themselves and are able to gain community insight in different ways, with a particular focus on health inequalities and the wider factors that influence health. And this group is it's a mutually beneficial space where we can come together, share ideas, and kind of review activity and strategies, and importantly keep ourselves as an HDRC accountable for kind of how we're including VCSE voice in our work. We also reimburse organisations for their time as an acknowledgement and thanks for their valuable input into our work. So there's various key activities that are undertaken as part of being part of our VCSE reference group, and these kind of include influencing potential research and priorities by guiding what the HDRC focuses on and making sure that it really does reflect the needs of local communities and partners, driving new ideas and providing expert advice from the ground, and supporting vulnerable groups by advising on how to involve and engage a wide range of different communities. A key activity here is also acting as a critical friend. So we really value kind of like constructive feedback on a range of like HDRC outputs, including strategies and policies, to make sure that they are staying kind of fair and effective. And then also building capacity by supporting members within organisations to develop their skills and confidence in using research. So over the next few months, we have a plan in place to go one step further than working with our VCSE reference group to establishing a community advisory panel, or CAP. Well, so hearing directly from those who live and experience the different areas across Newcastle every day. And the CAP will kind of be our main vehicle for community voices to be embedded into HDRC work and evidence-based decision making at the council. We're in the early days of developing our CAP, and we've kind of soft launched it to a number of groups to kind of gauge levels of interest and hear people's ideas of what would work well and what might not work when putting together a group like this. We want this to be kind of like a really useful group, so we don't want to rush into putting it together, and we've drafted a terms of reference, and we'd like to work with interested individuals to kind of develop this and make sure that it is fit for purpose. So we're planning to hold like a meeting quite soon where people can come along and find out more about what this would be involved, about being a member of a CAP, and fill out an expression of interest form to discover kind of whereabouts in Newcastle people are from, what they're interested in finding out more about, and kind of using it as a time to set realistic expectations of the group and allow people to ask questions before kind of like committing to being more involved going forward. A key consideration will be to not just hear from the loudest voices from our communities or kind of regular public contributors, but we're really keen to kind of like hear from as representative a group as possible to make up a strong CAP, gathering insight from seldom heard voices across the city. And to do this, we're going to work with organisations and other public contributors who could use their kind of wealth of knowledge and experience in this area to more like influence and encourage their peers who have like an interest in being involved in work like this, but may lack confidence to put themselves forward. So it's a really exciting area of work. So yeah, what will the CAP members do? So firstly, we'll work with this group to develop our community areas of research interest, or the ARIs. And I think it's worth mentioning as well here that we have developed some baseline community ARIs based on previous work from Newcastle City Council and the Newcastle Neighbourhood Network meetings, which you might have heard about, which have kind of happened over the past year or so. Through these meetings and events, and various assets and hot topics were identified across the different wards in Newcastle, and we want to show that we have kind of like listened to and acknowledged what is important, rather than kind of just again going out to the same groups asking very similar questions, but instead kind of using these baseline community ARIs to start conversations about like what is still relevant or what needs to kind of like change going forward. We want to ensure the HDRC research reflects real community needs, and CAP members will work alongside our VCSE reference group and researchers to influence and develop our HDRC research interest groups. Sorry, it is a bit deaf by acronym, but our research interest groups will sit under our academic collaboration further funding program lead, and these will be called our RIGs, which will be a list of key questions which we'll aim to address as a whole HDRC. But like crucially important, by including organisation and community voice in this, it'll ensure that ARIs aren't kind of skewed towards being very academic or very council-based, but a true representation of what's important to the people across Newcastle and what we could do to start to address this. CAP members will also have the chance to influence decisions affecting their community, gain new skills, connections and opportunities, and they'll also receive reimbursement for their valuable input and time. And we currently have VCSE organisation at strategic HDRC levels and have VCSE representation on panels such as our strategic advisory panel. And once our CAP is up and running, we will have public representation at this level as well. And then just lastly, as an HDRC, we do put on like a number of networking events and workshops throughout the years. And one of note that you might not have seen, or if you have seen, it's actually next Tuesday on the 17th. And we're looking to encourage as many people as possible to come, but most of the groups have now sold out, but we've reserved a number of tickets for VCSE organisations and member of the public, so that there's like really nice representation and a mix of people on the day. And we do still have quite a few spaces left for VCSE organisations and members of the public. So if you are a member of an organisation or a member of the public, and if you're interested or know someone else that might be, yeah, please do get in touch with me over the next couple of days and I can send you over the Microsoft form. I think it'll be a really great event, and we've got a spotlight talk from one of our community researchers on her work on perinatal mental health in Newcastle. Yeah, and here's just a bit of information about how to get in touch if you've got any questions or if you want to keep the conversation going. The HDRC email address in general is there. I've also put my email address if you got any questions directly from me, and I've also put a link to the HDRC Newcastle website. But you can just put that into Google and it'll come up. But yeah, I think that's everything from me. I'll stop sharing.
Oh, thank you both very much for those presentations. I mean, really important and impressive portfolios of work being described there. I mean, this is obviously open now. If anybody's got any questions, please raise your hand or put a question in the chat if you'd like to. Just whilst people are thinking, Grace, what's the best way for people to get involved with that? Is it just contacting you, or is there another process people should be looking at?
Yeah, at the moment it's just kind of direct contact. We're putting together a Microsoft form for expressions of interest, and then we're going to gather those and kind of that'll form who we invite along to this meeting that we're hoping to have in the next few weeks to gauge interest and, like I say, kind of like set expectations of what being part of this group kind of looks like. But it's very much kind of like word of mouth and snowball effect at the minute to try and get as many like different people on board as possible who may not necessarily be like tuned in already to the normal channels of sharing this kind of information.
Thank you.
For example, like we have public health champions, and we went along to our health champion network last week and kind of shared this information, and we're starting to get various expressions of interest through that way as well.
Brill, thank you. I can see a hand up from Peter.
Yes, thank you very much indeed. Can you hear me okay?
Yeah.
Yeah. Two questions, one very personal, inquiry, and one question. The personal issue is that picking up the learning to doing, I actually wrote my patient journey when I was an inpatient with a ruptured quadriceps ligament. As part of that, I made a recommendation that there should be a guideline drawn up for diagnosis of major connective tissue injury, because there isn't one, and I was nearly misdiagnosed. The patient journey is 19,000 words long, but it's not supervised, and I would like to turn it into something into something doing in the research field. I've tried to do this, but drawn a blank wherever I've approached for two reasons. One, it wasn't supervised, and two, there's a cost element to it. So if anybody wants to take on a potential fairly elderly PhD student with an ambition to write up this project as a piece of academic work, I'd be very grateful. Secondly, and perhaps more seriously, if you look at the national situation, we've almost got juxtaposed policies, and I'd like to hear anybody's view on this, and that we are getting rid of Health Watch, we are getting rid of public governors in NHS trusts, but there's lots of noise out there about the public voice and encouraging staff to speak up and transparency. And yet those two groups of issues seem to be juxtaposed, and I wonder if anybody's got a view on that. Or is it too political to comment on?
I think we're still waiting to see what's going to happen with Healthwatch. So I'm in close contact. Hello, Peter. I'm in close contact with our Healthwatch colleagues, and I think they're still waiting to hear about what that's going to look like in the future and what's going to happen to them. But yes, I hear what you're saying. It does seem how can you be accountable if you're actually in-house, putting in-house your patient voice work. So if it's going into the ICB, which is what they're talking about at this moment, I think. So yes, I don't have an answer to that, but I do note what you're saying and hear what you're saying. I don't know if anyone else here, if there's anyone who's more links to Healthwatch or the work that's happening there, who would be able to feed in at all.
Just to say, it does come from an informed point of view, because I'm a lay representative for Northumbria Trust, public governor for Newcastle, member of the leadership group for Patient Community So Nice, and also involved through NHIR with the institute, with this institute in Cambridge about the public voice. So I do have an interest in these areas. And
they're very good points.
Okay. Thanks very much.
Yeah, no, thank you, Peter. Judith.
Thanks, Quentin. Hi, Grace. I just wanted to ask you about, the community advisory panel, which sounds really great. And in the slides you said about trying to recruit not the usual suspects. So I wondered whether in the future you'd be able to maybe come back and let us know what mechanisms that you've used to do that. I'm sort of imagining within the council there might be some quite, I don't know, different communication channels or innovative mechanisms that you use to recruit people that really don't know anything about health research, that have never been involved in PPIE before. You mentioned your research into housing, and I've been thinking about, housing associations and tenant groups and how you can really link in with communities that we don't already link in with. Have you got any sort of ideas at the moment about how you're going to do that?
Yeah, I think it'll definitely be kind of like a learning journey, as this is something kind of like definitely new to the HDRC. But I think what's really important is to bear in mind that kind of like the public contributors also do come along with a lot of like wealth of experience and tips and like encouraging ways that they could also encourage their peers. So I'm hoping to work with a group of them to kind of like get that off the ground as well. What we don't want to do is kind of like duplicate what's already been done. So there'll be a scope and activity of what conversations are being had with the communities across Newcastle as in terms of the city council, and to make sure that we are actually, staying accountable to what we're saying in terms of speaking to different people who haven't necessarily had the chance to have their voices heard before. So it'll be lots of conversations, lots of different ways of working, but I'd definitely be happy to come back and kind of like share that experience to see if it would be helpful. Certainly if it was going to be replicated across different local authorities as well going forward, because it's a great opportunity to kind of get the voice of, seldom heard communities in this way, in a different way than it's typically done before.
That's great. Thanks, Grace, for that. Thank you.
Yeah. Thank you. Any other questions from anybody? Vicki, we didn't ask you earlier on, in terms of getting involved through NHRP, are there any other contact routes? I know Grace has explained how to reach out and get involved from that side. What about from the NHRP side?
So with NHRP, one of the ways that we're working about developing some of this work about supporting the VCSE around the sector around capacity and research is there is a delivery partners meeting. So people like Grace, there's someone from Newcastle University, CNTW, and Northumbria University, and NUF, and myself, obviously. So we are all linked and talking about how we're going to do this, take the work forward with the VCSE and how we might coordinate a little bit more. If anyone's interested in that and thinks they might have capacity, I think we also need to think about funding. How do we help support VCSE to be funded to be involved in being in those events, because it takes their time and effort. So I'm also exploring that. If any around that is interesting to you, or you think that's something you'd like to be have more involvement in, we are looking at Newcastle Gateshead area at the moment, mostly because they're our main partners. But just get in touch with me directly or at the NHRP general inquiries the general email, which I can't remember off the top of my head. Sorry, I'm still in holiday mode because I'm on my caravan. I can't remember what our email is even. NHRP at something. Newcastle.
I'll put it in the chat.
Thank you. Thank you for saving me there because I can't. Yeah. So yeah, get in touch.
Okay, and now just going to look in the chat to see what the questions are. So Diane, let me just see. Health Watch organisations won't all go at the same time. Contracts being fulfilled. I don't know if you want to just speak to that very quickly, Diane.
Yeah, I think each health watch has different contract end dates, so they're not all closing. They're not all just closing down. They will be living out the terms of their contracts. There is hope that some of the people who are involved with Health Watch will find out before they have to leave that what else is going to replace it. But there's just such a lack of clarity around the whole thing. But I think some people have got contracts until 2028, and they have said they will fulfil them. So it's not all closing down, and that's not very useful to anybody, but it was just a note to say that they're not all just closing at the same time. But we don't know what is going to replace it at all, what type of model it will be, even who will fund it.
Okay, brilliant. Well, thank you very much. We are just about out of time. So this has been another really useful interaction. So thank you all for the presentations. Are we going to put those presentations somewhere so people can have access to them if they want to? Is that going to be okay?
Yeah, so I'll circulate the slides and the recording of the meeting round this afternoon.
Wonderful. Okay, well, have a great rest of the day to everybody, and look forward to seeing you again all soon. Bye now.